Hey y'all, welcome to the Dosage of Drea Show, episode 3. So today's dose is all me. It's been a minute since we filmed, cause let's see, what did I do? I graduated from college. Let's see, December 12th, 2021 to be exact. I graduated from Cleveland State University with my bachelor's degree in journalism. So even though I achieved something like great, that was like a great accomplishment, 2021 was a difficult year for me because I was diagnosed with two autoimmune diseases. So I got my little notes right here and stuff so I could keep track of everything I'm gonna tell y'all because it's a lot. So even though I finished school, I finished Cleveland State in 2 years exactly, 2021, it kind of hit different. Like, I know everybody was saying like 2021 was like a rough year for them and stuff, right? So yeah, everybody was saying that. So it was definitely like, I felt that shit. Like, I didn't talk about it to anyone except for people like close to me, because it was like, I don't know how the fuck to explain this shit, because it was like crazy. Like, the shit that I went through, it was like so crazy. Like, I couldn't even believe I was going through it. So I was diagnosed with two autoimmune diseases. The first disease is called Eosinophilic Esophagitis, and the second one is called Hashimoto's disease. So let's talk about the first one that I was diagnosed with. The autoimmune disease Eosinophilic Esophagitis, aka for short EOE. So when I was first diagnosed with Eosinophilic Esophagitis, I was like, what the fuck is this? Like, how do I even pronounce this shit? Like, I don't even care to say it. But then when I found out like it's a rare disease, so I'm like, okay, this is something I'm gonna have for the rest of my life. So they say, you know, every disease is so-called not curable or whatever. So eosinophilic esophagitis is when your esophagus is inflamed and eosinophils get into the esophagus. Eosinophils are white blood cells. They should not be there. So basically, it's an allergic condition that happens in the esophagus. Inflammation happens and it can cause the esophagus to get narrow. So when your esophagus gets narrow, food goes down your esophagus. So if you have a tight ass esophagus, then shit can get stuck. And the eosinophils, they can cause damage and inflammation because they are not supposed to be in the inside of your esophagus. Okay, so let's talk about what causes EOE. So EOE is known to be triggered from doctors and stuff like that, whatever. I've been told it's triggered by, what is it, the top six allergens. So that's wheat, dairy, soy, nuts, any form of nuts, what else? Egg, seafood, and shellfish. So even if you're not allergic to any of those things, your esophagus is going to react. So your body thinks you are allergic to it. So your body is fighting itself to try to block out the invader, which they think is the food that you're eating, even if you're not allergic to it. So the weirdest shit I ever heard. So how did I get diagnosed? Okay, so I believe in going to the doctor faithfully. Like, I'll go to the doctor for anything. Like, constant follow-ups, whatever you want to, whatever. Like, if something I feel is wrong, I'm going to go to the doctor. So mainly I was going so much due to my mental health issues, but I'm going to save that for another episode. But anyways, I was going to the doctor because I kept having chest pain along with other symptoms like indigestion, stuff like that. And my doctor kept saying it was my GERD, which I do have. I have GERD, which is gastroesophageal reflux disease. I had that since I was in middle school. Yeah, a lot of shit. So fast forward, I ended up going to the ER for chest pain. They ran like a lot of tests, labs. I had an EKG, all of that. So they were like, you're not having a heart attack. So they were like, it has to be your it's GI related, gastrointestinal related. So but I did have a couple of PVCs on the monitor when they're monitoring your vitals and stuff like that. So I was referred to a GI doctor by the ER and by my doctor. So fast forward, I see a GI doctor and he wants me to get an EDG, which is an endoscopy. So an endoscopy is when they stick a scope down your throat or past your throat to look into your esophagus and takes pictures and stuff like that, get biopsies and shit to see what's going on or whatever. So yeah, that was basically my experience with EOE. My biopsy results did come back. Thankfully no cancer or anything like that. They told me I had eosinophilic esophagitis. That's what it was. And so basically with eosinophilic esophagitis, there's no cure, but it's a treatment. They do have treatments. They have 2 steroid options, which is budesonide, which is like a I don't take budesonide. I haven't tried that. So it's like it's a drink. It's some type of drink you mix and make together. And then the other one is you use an inhaler basically, but you don't inhale it, you swallow it. You take the puffs and you swallow it. And then the main treatment is the elimination diet, which is the hardest shit ever. Like trying to change my diet around, like completely, like not eating wheat even though I'm not allergic. I was already allergic to seafood. Like I knew to stay away from seafood. I'm like deadly allergic to seafood, so that's not a problem to avoid. But like soy, no soy. Like even I took an allergy test. I took a food allergy test and I found out I was allergic or sensitive to peanuts, white potatoes, and soy. And it's like I eat that shit every day. So like soy is in everything. So it's in Oreo cookies, it's in everything. It's not just soy sauce or anything, it's in everything. Yeah, so I found out I was allergic to white potatoes, which was weird because I eat french fries all the time, and peanuts. But you can become allergic to stuff if you eat things too much. Like it's called overexposure. But I'm not allergic like I am to seafood. It's not an anaphylactic reaction, it's a sensitivity. So it does something to my body. I just don't know what it is or what it does. It could be inflammation, I don't know. Most likely it is. But it's all about finding your trigger foods with eosinophilic esophagitis. Like, so that's how the elimination diet goes though. So eliminating the top 6 allergens, seeing what's your trigger. So like right now I still haven't fully done the 6 elimination diet because I'm pregnant, and that's not something that's going to be done overnight. Like that shit is hard. Like not being able to eat wheat, dairy, eggs. Like right now I'm not eating wheat and eggs because I think those are my triggers. Like every time I eat those I start clearing my throat a lot, my chest hurts. So yeah. So yeah, the second autoimmune disease that I was diagnosed with is Hashimoto's disease, and hypothyroidism. I was diagnosed with that, but it turned into Hashimoto's. So basically the story about how I got diagnosed with that shit is just crazy. Like once y'all hear the story, y'all gonna be like, damn, you need to sue somebody. But it's not that easy, so I'm not even gonna waste my time with that. So Hashimoto's disease, Hashimoto's thyroiditis, is inflammation of the thyroid. Your thyroid gland is the butterfly gland shape that's in the front of your neck. So basically the thyroiditis can cause your thyroid to not make enough thyroid hormone, and occurs when your body makes antibodies. So that attacks your that attacks the cells in the thyroid. So Hashimoto's disease is once your body has developed antibodies. So that's what I have. But basically, the story about how I got diagnosed is so long. Like, I'm gonna try to make it short though. So basically, I gave birth to my son in December of 2020. That's my second child. I was okay. They did blood work and everything in February. I gave birth to him in December. They did blood work. Everything was normal. When you get your complete blood count, that's the CBC. That's the complete blood count panel of everything that's going on in your body, the cells, all of that. The TSH is what your thyroid is. That's the thyroid hormone, thyroid stimulating hormone. That's what they check for, basically. So that was normal. Every time I get blood work, it's always normal. So like I said, I see my doctor a lot for mental health issues. And I see her like every month. So basically, I was like, something feels off. Like around 4 months postpartum, I was feeling weird. Like I had all these weird symptoms. Like my arm was tingling. I had tingling in the front of my head. Like I thought I was having a fucking stroke. And so I went to the doctor. They did like a little neurological test exam at the office and stuff. And they were like, you wouldn't even qualify for MRI of the brain because I could follow her finger, all that other stuff. So basically, they kept blaming everything on my anxiety because I've had anxiety and depression since 2010. So they kept blaming everything on my anxiety and my depression. And they were like, oh, you just had a baby. It's normal for things to be off in the body, or for you to, because I was extremely tired. I was always tired. And I was getting hot. I was always burning up. Like I would ask my husband, like, are you hot? Is it hot in here? And he would say like, no. And I'm like, oh, well, it's just me. And so yeah, they were blaming everything on postpartum and my anxiety and the GI shit that I had going on. But I just kept going back. I wasn't feeling well. So then I went to an express care, and I'm like, yeah, I was feeling weird. Like my heart rate was super low, like, but I don't know why. They were just not paying any attention to that. Like I'm looking at my chart and I'm like, what the fuck? My heart rate is like 40 something. I'm 25. I should not have a heart rate, beats per minute, BPM. I should not have beats per minute at 45 or 50. Like that's like an athlete's or an old person's heart rate. So she did, because I kept going for the chest sensation, like, and she did an EKG. This was before I was diagnosed with EOE. Like I was diagnosed with EOE and Hashimoto's disease like around the same time in July. This was like May, around my birthday. She did an EKG. And she was like, everything was normal, but she's like, you having some PVCs. That's what the nurse practitioner told me at the express care. I'm like, PVCs. Yeah, they told me I had a couple of those at the ER, but they made no big deal of it. So basically, PVCs are premature ventricular contractions. So basically, it's either when your heart skips a beat or it has an extra beat. I've been told I had heart palpitations before from anxiety when I was a kid, but not like where I was having so many. So I went to the doctor about it, and I asked my doctor, and then she was like, I actually saw her assistant because she was booked. My doctor was booked, so I saw her physician assistant. And she said, I'm going to order you a Holter monitor. You're going to have to wear it for 48 hours. And then we're going to read the results and see if you were to go from there. So I wore the Holter monitor for 2 days. And they called me in the morning, which I'm like, oh shit, they called me first thing in the morning. That's not good. So they were like, yeah, we need to make you an appointment with a cardiologist ASAP because I guess I was having a lot of PVC. So fast forward, I saw the cardiologist. She was like, you having some PVCs going on, girl. Like you was having them like 40 to 40% of the time the monitor was on. Like they wanted to see how my heart acted when it was resting. Like when I'm asleep, when I'm active. Like, they want to see why I'm having PVCs. Is it because I'm anxious or what? But I was having them even during bedtime. So the cardiologist, she ran a whole bunch of tests. Like, she did like all types of blood work I've never had before, like of the heart, see if I was having a heart attack, all types of stuff. All my blood work came back normal. Like, she was like, you're not having signs of heart failure or anything else. She was like, I see they haven't tested your thyroid. Your thyroid hasn't been tested since February. Because she listened around my neck area. She listened to everything. She told me she wanted me to have an MRI of my heart, which I had never done before. And that was like uncomfortable as shit, because if y'all ever seen the In the Club, or was it Wanksta? I don't even remember what music video that was. 50 Cent was in, but it was like that tube thing you go in and it's tight in there. Like, and if you claustrophobic, you might not be able to do that. So I was just, I don't know. But my heart MRI came back. Nothing was wrong with my heart. It was no signs of heart damage, heart attack, stroke, or anything. So she told me, she called me, she said, yeah, girl, everything was normal. She said, but your thyroid is jacked up. That's exactly how she said it. She was like, your thyroid, it was like over 100. It was over 100 levels. So it was super underactive. That's why I was even gaining weight from a point in time. Like, I never lost my pregnancy weight, and I've always been petite. So I was actually holding some weight, and I never hold weight. Like, when I had my daughter in 2018, I went right back slim. I was actually holding weight. So that's another sign. That can be a sign of a disease, or whatever you want to call it. Weight gain, depressed more than usual, thinning of the hair, everything, fatigue, all types of stuff. But yeah, mine happened to be low heart rate, nerve. It was messing with my nervous system. Like, my doctor, she was swearing that it wasn't anything like that, but I talked to an endocrinologist. She said, yeah, your thyroid is very powerful. Like, it controls a lot of shit in your body. So yeah, your thyroid controls a lot of shit in your body. And I didn't know that. I was uneducated when it came to the thyroid. Like, I never knew how powerful it was until I started going through all this shit. Because I went through so many doctors, and the problem was my thyroid. They never tested. They did all this blood work. They didn't test my thyroid at the hospital when I went to the ER the one time for my the GI problems I was having. My doctor, she refused to give me blood work again, because I had just had it in February. But like, as if shit can't change in a few months. Like, everything was literally normal in February, and then months later it wasn't. Like, when I was like around, that was when I was 2 months postpartum in February. I was 4 months postpartum in like April, and then 5 months postpartum in May. And so basically the endocrinologist was saying to me that during those stages I was at, where I was feeling more anxious and my heart rate was going faster, I was in a hyper stage. Like, there's 2 stages of thyroid disease. It's hyperthyroidism and it's hypo. Hypo is what my thyroid crashed to. It crashed to hypothyroidism, and that's what made my heart rate slow down. So it can affect your heart. It can affect a lot of things in your body. So always follow your body. Like, don't listen. Like, always keep going back, getting second opinions. If one doctor tells you one thing and you believe it's another, like, don't stop, because I could have seriously been messed up, like fucked up, possibly even died. Like, if I would have kept letting those symptoms build up and trusting that it was my anxiety or whatever you want to call it. Like, I was messed up, like feeling fucked up for months. Like, and so yeah, that was basically it though with the thyroid. It's really more, but we'll be sitting here all day talking about it. Like, my husband, like, literally, like, has to hear me talk about this shit every day, like, because I'm like scarred. Like, I'm at a point now where I could kind of laugh. Like, you've probably seen me laughing a little bit throughout this shit and smiling and shit, but I'm getting to a point where I could, like, smile and talk about it more so than, like, cry or get teary-eyed or whatever, because that shit was depressing as hell. But yeah, so basically where I'm at with that is trying to change my diet, because a lot of the shit that we eat are a lot of the triggers for these diseases that we get diagnosed with. And right now I have to take a pill every morning for my thyroid, like every morning. Like I can't go without it. They say I have to take it for the rest of my life. But we don't know if it was just postpartum, because I ended up pregnant in October at around 10 months postpartum. So we couldn't test to see if it was just postpartum, which is most likely not, because I developed antibodies. So when you have antibodies, that means it's pretty much there. So I might have this disease for the rest of my life, most likely. But yeah, I have to take a pill every day, one time every day, hours before I eat anything or drink anything, on an empty stomach, so the thyroid can absorb and help. So my levels have been pretty much normal. I'm pregnant again with baby number 3. So that's pretty much why I wasn't filming or anything right after I graduated not high school. That's pretty much why I wasn't filming right after I graduated. Oh yeah, when you with thyroid issues, it causes memory loss. Like, I forgot to talk about that. Like, my memory has been bad. Oh, brain fog. Yeah, brain fog. My memory has been terrible. Like, and I'm a person that remembers everything. I can tell you what happened the first week of preschool. Like, I have a great memory. So when I started forgetting shit, like, I'll say something and I will forget what I just said. Like, if you watch episode 1 of the Dosage of Drea Show, like, I was talking to Victoria Marquise, I can't remember, and I paused for a second. It's kind of noticeable if you watch the episode. Like, I literally forgot so quick what we were even talking about. That's why I keep notes now. Like, even like, because if I didn't have these problems, I wouldn't be reading a notebook. I would just go off my brain. But yeah, like, I made it. I went through all of that though while in college. Like, I was diagnosed with all of that over the summer while I was taking summer classes. I really wanted to say fuck school, but I'm like, I came too far. Like, and I finished, thankfully. I had understanding professors and everything, and my husband was a big help. So yeah, that was a good thing though, to have understanding people around you, because I couldn't do this shit. I couldn't be like this and work a job. Like, I'm, not a regular job, because they don't understand shit like that. They don't understand when you go through shit, like, life changes. And because I've never had to take medicine or anything. I've always been healthy. I mean, I'm still technically fairly healthy, but I just have these fucking diseases that I have to deal with, these 2 autoimmune diseases. So my body is always fighting itself, fighting the good shit in my body, fighting the bad shit. So yeah, so basically I wanted to tell you about those 2 diagnoses. I won't probably have any more episodes like this. I might, I don't know. I'm pretty much hoping to always have a guest, but it might just be me sometimes by myself. But yeah, I wanted to talk about the EOE and the thyroid disease. I feel like I'm leaving some stuff out, but I might do another segment about it. I don't know, but I just need to get another episode out there, because I want to get you warmed up for the new content that I have coming soon. So anybody that watched this episode, I appreciate it. Thank you for tapping in. Yeah, so make sure to like, comment, subscribe. Any questions about this shit that I didn't cover, or if you are curious about anything else, just message me. I guess I'm always open to talk about symptoms. Like, I've actually talked with a lot of people about people that are close to me about it, and they be like, damn, I be having some of them symptoms. Like, do I have that shit? Like, or you never know. So just go to the doctor. Always go to the doctor, because I wouldn't have known that shit. Who gets the fucking scope down their esophagus all the time? You don't know what's going on in your body. So pay close attention to symptoms that you have. So yeah, that is the end of this episode. Thank you for watching. So don't forget to like, comment, subscribe. Any questions, I'm here. No negativity, because any negativity will be blocked.